Hepatitis refers to inflammation of the liver. It can be caused by various factors, including viral infections, exposure to certain toxins, autoimmune disorders, and excessive alcohol consumption. The most common types of viral hepatitis are Hepatitis A, Hepatitis B, and Hepatitis C, each caused by different viruses, HAV, HBV, and HCV, respectively. Let's know about each of these hepatitis. Hepatitis A, HAV. Causes. Hepatitis A is caused by the Hepatitis A virus, HAV. Transmission. Typically spread through the fecal-oral route. Contamination of food, water, or objects by the virus can lead to infection. Person-to-person transmission can occur through close contact or sexual activity. Incubation period. The incubation period for hepatitis A is usually between 15 to 50 days. Symptoms. Symptoms can range from mild to severe and may include fatigue, jaundice, yellowing of the skin and eyes, abdominal pain, nausea, vomiting, and fever. Children infected with hepatitis A often have mild or no symptoms. Acute infection. Hepatitis A infection is typically acute, and most people recover fully with no long-term liver damage. Severe cases, while rare, can lead to acute liver failure, especially in older adults or those with pre-existing liver disease. Testing and diagnosis. Blood tests are used to detect antibodies or viral genetic material to confirm the diagnosis. Prevention. Hepatitis A vaccination is a highly effective preventive measure. Practicing good hygiene, including thorough hand washing after using the bathroom and before preparing or consuming food, is crucial in preventing the spread of the virus. Avoiding the consumption of contaminated food or water. Post-exposure prophylaxis, PEP. For those who have been exposed to hepatitis A and are not vaccinated, a hepatitis A vaccine or immune globulin can be administered as post-exposure prophylaxis. Vaccine. The hepatitis A vaccine is part of routine childhood vaccinations in many countries. It is also recommended for individuals at higher risk, including travelers to regions with high hepatitis A prevalence and certain high-risk groups. Global impact. Hepatitis A is found worldwide but is more prevalent in regions with poor sanitation and limited access to clean water. Travel considerations. Travelers to regions with high hepatitis A prevalence are often advised to get vaccinated before their trip. Hepatitis A is a preventable disease, and vaccination is a key strategy in reducing the incidence of infection. Practicing good hygiene and sanitation is also crucial, especially in areas with limited access to clean water. Timely vaccination and proper public health measures contribute to the control of hepatitis A and its potential impact on individual and public health. Hepatitis B. Causes. Hepatitis B is caused by the Hepatitis B virus, HBV, which is a member of the Hepadenovirus family. Transmission. Spread through contact with blood or other body fluids from an infected person. Modes of transmission include unprotected sexual intercourse, sharing of needles or syringes, mother-to-child transmission during childbirth, and exposure to infected blood or body fluids. Symptoms. Many people with hepatitis B may not experience symptoms, especially in the early stages. Symptoms, when present, can include fatigue, jaundice, yellowing of the skin and eyes, abdominal pain, nausea, and dark urine. Acute and chronic infection. Hepatitis B infection can be acute, short-term, or chronic, long-term. Chronic infection can lead to more severe liver conditions, such as cirrhosis and liver cancer. Testing and diagnosis. Blood tests are used to diagnose hepatitis B by detecting viral antigens and antibodies. Routine vaccination is available and is a highly effective preventive measure against hepatitis B. Treatment. Acute cases may not require specific treatment, but chronic cases are managed with antiviral medications. Liver transplant may be considered in severe cases. Prevention. Hepatitis B vaccination is a key preventive measure. Practicing safe sex, avoiding sharing of needles, and proper screening of blood products contribute to prevention. Hepatitis C. Causes. Hepatitis C is caused by the Hepatitis C virus, HCV, a member of the Flaviviridae family. Transmission. Primarily transmitted through exposure to infected blood. Common modes of transmission include sharing of needles or syringes, blood transfusions from infected donors. Though rare now due to screening, and less commonly, through sexual intercourse and from mother to child. During childbirth. Symptoms. Similar to hepatitis B, many people with hepatitis C may be asymptomatic. Symptoms can include fatigue, jaundice, abdominal pain, and joint pain. Acute and chronic infection. Acute hepatitis C infection can progress to chronic infection, which can lead to liver cirrhosis and an increased risk of liver cancer. Testing and diagnosis. Blood tests are used to detect the presence of HCV antibodies and confirm the diagnosis. New antiviral medications have significantly improved treatment outcomes for hepatitis C, leading to high cure rates. Treatment. Antiviral medications, such as direct-acting antivirals, DAs, are used to treat hepatitis C. The goal of treatment is to achieve sustained virologic response, SVR, indicating that the virus is undetectable. Prevention. No vaccine is available for hepatitis C. Prevention strategies include avoiding sharing needles or personal items that may be contaminated with blood, using barrier methods during sex, and proper screening of blood products. Both hepatitis B and C infections can have serious consequences for liver health, ranging from chronic inflammation to cirrhosis and an increased risk of liver cancer. Prevention through vaccination, safe practices, and public health initiatives is crucial in controlling the spread of these viruses. Early detection and appropriate medical care are essential for managing and treating hepatitis A, B, and C infections.